Awesome. Well, it's so great to have today here at Planetary Health First, Mars Next. My name is Michael Mann. I'm the host, and this is really coming after an amazing health innovation pitch party. There was only 6 startups, and I think the application list was very long. Don't have that exact number, but here we have 2 amazing founders, partners. And before we get going, one of you, would you start, Afreen? Would you introduce yourself, please, and just tell us a little bit about you?
Of course. Thank you, Michael, for talking to us today and learning more about what we do at Citrus Oncology. My name is Afreen Shariff. I'm a board-certified endocrinologist. I'm an associate professor of medicine at Duke University. I lead a lot of national and international efforts around side effect care and toxicity management, and I'm also the co-founder for Citrus Oncology.
Afreen, go ahead, Aabid.
Yeah, okay. So I'm Aabid. I'm the co-founder and CEO of Citrus Oncology. I have a PhD in computer science from Carnegie Mellon. I spent 15 years in the life sciences and AI space, managing lots of different complex life science operations. But since the last year, co-founded Citrus Oncology, partnering with Afreen here.
Where do we start on this? This is such a complicated journey. Someone gets cancer, and you really, the little that we were talking in the green room, you are really empowering oncologists to be able to do what they do, and these side effects. Tell us your journey. Let's go ahead and get into what the importance of this collaborative care and what Citrus is really doing.
Well, that's an excellent question. I've spent my entire career managing side effects and toxicities, and I've built programs around this. And really, as I've been around the country, around the world, giving talks to mostly oncologists and how to manage these conditions, it really dawned to me that there is such a need and such a gaping gap in how we manage side effects and toxicities. We have 85% cancer patients who go to community cancer centers to get their care, and only 15% are coming to the ivory towers medicine, where people like me who have deep expertise in this subject live. So there's really a mismatch in location and expertise and the number of people we can make who can actually manage the side effect. And this has been a thought that I've been brewing in my head for a very long time. And it really hit home for us when Aabid's nephew passed away at the age of 8 because of a toxicity from a neurologic toxicity from immunotherapy. He did great after 2 bone marrow transplants. And what really took him down was a side effect. So it really got us thinking that we wish that he had access to a neurologist who understood toxicities and side effects. Would that have changed the course of his care? Would that have changed how he lived his life? And that's when we decided that really things have to change. We have to make this better for everyone around the world. And this cannot continue. This is a problem. This has been a problem for many years, many decades, depending on which chemotherapy, radiation treatment patients are on. Now with immunotherapy, immune checkpoint inhibitors, CAR T cells, and bispecifics, the market has really evolved and expanded to a level that oncologists are really trying to catch up with managing side effects and toxicities that really need specialists like endocrinologists, rheumatologists, cardiologists to support them. And while they are really trying hard, we're asking a lot from them beyond treating what they're great at doing, which is cancer. So that's kind of in a nutshell what really excited us and made us very passionate and really added purpose to what we do at Citrus.
I hear a really design center approach. This product you're working at Citrus, that to leverage the asynchronized, synchronized. Would you like to talk about that? I mean, that must be, and then unlocking that with these other experts.
So yeah, the way the platform works is there's 2 problems that we're trying to address, right? Number one is access to care, and the second one is fast access to care. So in order to enable both, you need to get the right sets of physicians at the right time, right, and to connect them with the right patient. And so what we decided was that asynchronous care, when physicians, when you find the right folks, they have some time available during the day, or they've blocked off a couple of hours, or they're taking like a half a day, they only work part-time. Some of these physicians can really, when connected with the right patient, can deliver the care instantly that they need. Cancer patients, they are in they're already going through a lot. I mean, when learned about the experiences, and I've spent talking to hundreds of cancer patients the past year, the things that they go through, and if they have to get access to care that very same day or the next day, it's just impossible. They're waiting for months for an appointment just to figure out what they even have. So we felt like taking advantage of asynchronous technology was the way to go. And in some cases, we do need to see the patient. And so we would then do video visits if needed.
Yeah. I'm going to elaborate a little bit on what Aabid just mentioned about that patient experience, right? And how that really plays out today, and how we're really trying to create a paradigm shift with the technologies and the expertise that we're creating through Citrus, right? So right now, most patients, most individuals with any disease wait about 3 to 6 months to get into a specialty appointment. I'm sure you have waited if you have ever needed a specialty appointment this last year. Aabid got an appointment for his gout like a year and a half later. So just imagine that. So imagine for a moment, this is a cancer patient, and this individual is waiting to get answers by a specialist for months to weeks. Their treatment's held, they're being hospitalized, they're suffering because they're either itching, they're weak, they're tired, they're not eating, they're having diarrhea. That really impacts the treatment decisions of what the oncologist does. That is the status quo. And if the patient is sick enough, the oncologist probably picks up the phone, calls up a friend and says, hey, do you have an appointment? Can you try to fit them in and scramble this person in, because I really think you need to be seen. Now, you're really relying on a very broken system to help the sickest patients that are going in and out of the ER, right? So that's how we are doing this today, right? Now, let's talk about our approach and how we are really trying to fix this issue from a patient and physician provider experience, right? Patient gets diagnosed with cancer. They enter into our platform where they have access to report new symptoms or ongoing symptoms. And this is where they get connected to a specialty team that understands side effects, understands what they're going through, and can ask additional toxicity and side effect focused questions to patients and actually provide what Aabid was mentioning, asynchronous care over messaging-based platform, or if the patient is sick enough that they need to be seen or has a severe toxicity that needs to be addressed in a video visit, we absorb them really quickly depending on how sick they appear on this messaging-based application and determine, okay, this patient A versus patient B, patient A needs to be seen sooner, needs to be seen within the next week, needs to be seen by an endocrinologist or a cardiologist. And hey, click here to make that appointment with the specialist, and we get them in. And that's how we provide not only asynchronous assessment, triaging, and care for patients, we also take the sickest of the lot and put them into our virtual clinics where we're able to directly impact that patient's care, get them started on treatment, diagnostic tests, tell them if it is a problem or it's not a problem. Sometimes that's also enough. I tell my patients, half my job is to tell you what it is, and half my job is to tell you what it's not. And both of them are good answers because it gives closure to what's going on with them, right? And getting that answer quick is really where the shift will happen, and the shift is happening in how we do things compared to the status quo that I just mentioned a few minutes ago.
So it seems like you're really able to help in lots of areas, whether it be CROs, whether it be, I mean, just patient care, and, I guess with the efficacy of the treatment as well. By doing that, you're able to get, I imagine that's one of the areas you're working on, is getting that evidence with your procedure versus not. I mean, to me, that's the holy grail, is that by using Citrus, not only are you managing and making that patient experience, but outcomes are, and I know it takes, I imagine the data and all that takes a while, but that's what I'm hearing. You're really delivering healthcare to the highest and best level, and not preventing anything that needs to happen.
Yeah, no, I'm going to share a bit of a piece of information or a study that this is a study that came out from my work at Duke, where we do fast access consultations for patients. I direct the oncoendocrinology program there, and we do MD to MD consultations, which is if an oncology patient has a problem, the oncologist puts in an MD to MD kind of review or a peer-to-peer review, and my team reviews the case within 48 to 72 hours, does not see the patient, just reviews the case electronically, asynchronously, and tells the oncologist what needs to be done. Now, by doing this, we were actually able to lower hospitalization rates by over 70% for endocrine side effects in cancer patients who are treated with immune checkpoint inhibitors. So there's really a precedence and an experience behind what we're trying to do at Citrus, and we're really trying to take the findings of what was created at a closed center, right, at an academic closed center, and really take that and scale it at an enterprise level throughout the country, right? So we do have some footing in the door with regards to the fact that intuitively it makes sense, but we've also proven it in other work settings that this is actually makes a difference in the patient's journey, especially with regards to hospitalizations and ER visits.
So what is the biggest thing you've learned by doing startups? Obviously, you went to medical school. I don't think you ever thought you were going to be startup founders. Tell me a little bit about you working together, collaborating. I'd love to hear the human side. Obviously, you guys are super smart, but just what is it like being co-founders, working together?
Aabid, do you want to take that, and then I can wrap up?
It's a very interesting experience. So let me just say that so this is my third startup gig. The first one, we're an employee-owned company. It was came out of Duke, and we sold the company to a Fortune 500 company. I also worked at a much larger CRISPR biotech company. Really enjoyed the startup experience. Trying to own lots of different problems and being heavily problem focused, mission focused. So I think I'd say I really enjoy that experience. And also the other part is trying to improve the odds of success, right? Because we have a limited pot of gold and we gotta survive. So so startups is one of the places that I really enjoy working at. But I'd say as co-founders, it's been the decision to work together. To me, it sounded like we really wanted to get the outcome, and having Afreen and her experience and the problem with my nephew, I felt like we have a potential problem and solution here within the family. And one of the things that you learn to be as a founder, you want to be a generalist, right? You care more about the outcomes and solving the problem. And this turned out to be the best approach. And luckily, Afreen and I, we get along as partners and as a company founders as well. So far.
Well, thanks, Aabid. A lot of times I'm going to jump into the human aspect of this, right? I already have a book that I am working on in my mind, and I already have the name for the book. It's called A Couple of Co-Founders, with a couple being in quotes, right? So it's a very interesting dynamic when you think of it, right? And a lot of people, when we told family, friends that we're going to start a company together, we're going to be co-founders, the first question some of the folks asked, like, why would you do that, right? So it's interesting. And my response always was, hey, we've lived for more than 15 years together. I mean, we're hitting at 17, I think, right now. More than 15 years together, raised 2 kids, residency, fellowship, PhD, moved like a gazillion times during all of these first few years. If we can handle that, I think we got the appetite to do a startup, right? It can't be any different. But there's certainly a journey when you work with your co-founder / partner / husband or wife that you are used to working outside of your home in your different work environment, and you bring work back home, right? So I think those kind of things, the boundaries, the when to discuss what, and also shared responsibilities as parents, balancing that really takes a lot of intention and a lot of thought into it, and kind of knowing where to treat your co-founder as a co-founder and knowing when to treat your co-founder as a partner, making that distinction really clear. And it's an iterative process. It's a learning process, a learning curve. It's not for the lighthearted. So I'll tell you that.
I love the energy you have, and it just makes me want to think, what's Citrus? Where did Citrus come from?
So we were actually celebrating my brother-in-law's 60th surprise birthday. We were in Florida. So kind of Citrus came to mind right then. But we were thinking of, how do we brand it something that is simple, that's easy, right? So we said, okay, it should sound like Apple, like something that's, it makes no sense why a tech company is called Apple, but people say it's easy, right? So we said, okay, Apple's taken, but a B for banana doesn't sound really nice, right? So C for citrus. And then it was like, okay, fresh approach to managing toxicities was the first thing that came to my mind. And then I'm an artist. I love to paint, artwork, all of that stuff. So I really thought of the colors and the logo and how it would be appealing, the white, orange, green, really crisp colors. Design wise, it shines, it looks nicer.
Mhm.
It looks great on slides. It looks great on presentations, the website. The color scheme looks good. So it was a whimsical thought that really became very intentional when we were trying to design stuff. So I designed the logo on the flight back from Florida to NC. So, and send it out for to the actual people who know how to make logos after that.
I love it. I think citrus is something fresh, and you want to. I mean, so it really imbibes the brand essence positive. So I think you hit it. It's awesome. So what you're doing is really important. And again, I want to congratulate you on your success with the pitch, the Health Innovation Pitch Party. What was your feeling on Charlotte? Will you guys be growing? I know you shared Cary. I could see you having an office there one day. Not that I'm pushing this or anything, but it seems like there's like really places, ecosystems as you evolve out. I'd love to hear your thoughts on that Health Innovation Pitch Party.
Yeah, that's really a terrific experience. And just learning a little bit more about, we're only a couple of hours away. We're not that far. Really, been lots of times in Charlotte, enjoy, hanging out in Charlotte downtown. But for the first time, I think I learned about the Pearl Innovation District and the vision for the area and where you want to go. It was really, really fascinating to learn about all of it. So I think I'm going to be visiting in a couple of weeks. There's also an opportunity for us to spend a little time there and learn a little bit more. So yeah, looking forward to learning more. But I'll just say that just fortunate to be in a state like North Carolina and the really great support that we've had from the ecosystem here, and that includes Charlotte as well. Anyway, so I'll just say that for now, but yeah, looking forward to learning more.
And so as we're talking, and of course there's audience that would hear from a patient, for partners, potential partners, I'd love for you guys to kind of showcase where you're going these next, let's not say a year or, obviously you have a vision for years to come, but where do you see in the next several months or this calendar year, if you would, what you're up to and what would you like to happen with partnerships or raising, that sort of thing? Yeah,
so we've had one of the things that when we started this company, we weren't sure if this was even a business, right? Is this a nonprofit? Should be a for-profit? So when we started hearing about the demand for this, we really needed. We said, hey, we need to take this thing very seriously and start this off as a company and do this in the really right way. Since we started getting the word out, we've had lots of different oncology groups reach out. And we've actually had pretty significant traction. We've kept the number of patient volume that we've seen so far low, so we can iterate and learn. We have to deal with many different situations like prior authorization and others. So, but now our goal is to execute on all of the pilots, and some of them are paid pilots that we have ongoing. We're also doing a very short fundraise to try, to raise a little capital, because one of the oncology groups is a large enterprise group, and so they have an elevated security requirement. And so to execute on all those pieces, they want to have one-click button of sending a referral, and then things need to be coordinated in a really nice way. So execute on some of those additional things. So we're doing a short fundraise there. But we'll hopefully by the end of the year, we'll have a lot of data collected, and Afreen can share more about that as well. But we'll be able to really show some of our value and how we've been performing.
Yeah, I think we're hoping to close some of our pilots with the KPIs that we want to collect on each individual one of these pilots, and they're very uniquely positioned. We love to work with our oncology partners as we're trying to work together rather than their clients, and we have this one-size-fits-all approach to managing a particular practice. So we really go into the deep, have meetings regularly with them to understand their needs, and what are the key performance indices that they're looking for that matters to them and their practice, right? So we hope to have some of these done by the end of this year, and perhaps even sooner than the end of this year. The other thing that I'm going to mention over here is the issue of scale and efficiency that I think we will be at the point next year, or at least we hope that we will be, where the way I envision it is that we as physicians or providers have access to summarized toxicity specific information that allows us to really scale our time and efficiency. It really solves the issue of access, right? I'm sure people who are listening are going to ask, hey, you don't make that many doctors every year. You don't make that many endocrinologists. How are you going to meet the increasing demands for oncology patients, right? Which is steadily increasing, not just in the incident phase, but in the survivorship phase, right? So how are you going to meet this demand? And I think at the end of 1 year, our goal is that we are able to scale the time of existing physicians by using these AI assist technologies that allows us to do more consultations per hour, more informed, educated consultations per hour, that allows physicians and providers to really perform at the top of their license and spending less time in summarizing and pulling data from different streams. And that, as a physician who does this day in and day out, that is a game changer for me. And the number of physicians we have right now, they are actually absolutely looking forward to this technology to actually assist them right now. They're like, when are you going to release the technology? When can we have our hands on this, right? Because it allows them to be anywhere and yet be everywhere, and yet do this on their own time, and yet do this in a way that intellectually stimulates them rather than doing all the busy work that we all don't like, right? There's a reason why physicians and providers are getting burnt out in oncology and other specialties. The scale and efficiency is where we're missing the piece. We just can't have technologies that work for tech businesses and for patients, but don't work for physicians and providers, right? So we're really solving the solution, not just from a patient experience, but also from a physician provider experience, that we want to make it in a way that people would want to work with us. They want to be on our practice. They want to be on our platform. And it's a win-win for patients. It's a win for us. It's a win for all the physicians and practitioners on our practice.
I know as a startup, you want to really super focused, you're on oncology, but I feel like what I'm hearing, your platform almost to the complex, the Medicare, it's so, there's so many specialties that touch the older adult, the 65 plus. I feel like you're creating a product, a solution that could really help in that complex patient in general. Is there any areas outside of oncology? I mean, forgive me for sidestepping, but I guess I just feel like it's so complicated in healthcare, and what you're solving is really the challenge with access across the board.
Absolutely. I think that's a wonderful question, and not a question that we haven't been asked before, right? Because these same board certified physicians who are highly trained in managing the sickest patient population, which is the sickest and the patients who need the fastest and the most critical access, are oncology patients. If you can take care of that and you can create a system that works for that complexity, managing someone with diabetes or managing someone with just routine heart disease is actually very easy for our practice to do then, right? But the thing that we want to do first is go deep and then start going broad, right? Because what I've learned, and I've learned in research and medicine and practice, and now as a startup co-founder, is that you want to really finish your product to deliver for a key wedge in the big pie. And then you expand to other things. So what you're saying is not something we're not thinking about. Are we thinking about it at this moment because we have all these clients that we're working with oncology? No, but it's something that we are absolutely thinking about. It's in our sight. We just haven't started like honing down on that product line yet. But if we get the right client, if we get the right payer partner who's interested in this, it would be very easy for us to diversify and actually use the same infrastructure to deliver on that. So it's a matter of what are the opportunities that come our way, and how do we want to tailor this infrastructure, this practice, and this approach to solving one issue versus another issue versus another issue, right? So we can apply the same thing across the board.
Well, I'm really, really super excited for you. I know you're helping so many people, the patients, the oncologists, to be the best. As we're kind of coming towards the latter part of our discussion, what would we want to kind of hit home in the rest of our discussion?
Yeah, I think maybe one. I think you're seeing a lot about AI and technologies these days. I think there are lots of new solutions that are being built for many broad areas to capture a pretty large market. But I truly think that having a solution in mind, finding a problem, is one way to go. and that really would benefit lots of people. But if to make a true impact, starting with a problem, and you've heard it lots of times, starting the problem and building the solution is probably the right way to go, and to create the impact that it's much more narrower in focus, relates to what Afreen was saying in the previous question. But I think that's where we're focused on. How do you build clinical teams, the right language, the right communication, the right technologies, all working together to solve one single problem? I mean, when you look at it that way, you can get the impact that you're looking for, and much more.
Yeah. I think well said on that, Abid. And Michael, I'm just going to share a thought over here, since we were talking in the green room prior to this, that we actually are building targeted programs towards disease groups, even within the oncology focus, right? Like, how do we solve the problem for pancreatic cancer patients and get them access to endocrinologists? Because 85% of pancreatic cancer patients have diabetes or will develop it either before, after, or during their treatment. So there are these tailored, structured programs that we're thinking, because patients, guess what, are not going to come in saying that I need an endocrinologist. They're going to come in with a problem. They're going to say, I got this cancer, these are the symptoms, and that's the problem we need to solve. And tailoring it to the right patient, to the right disease, to the right disease group, to the right kind of treatments, the cancer, the radiation, and using the right technologies to answer and solve those questions where physicians, providers, and systems fail or are clumsy, is really what we're trying to build over here. Is go from the problem, go backwards, and fit technologies and people where they need to fit in to solve that problem. And this is what I always say when we're trying to adopt for new technologies in AI and healthcare, is the sniff test, right? You got to sniff the technology. You got to see, is this company have technology that they want to put on a problem and expect and hope that it's going to solve, which is where the physicians and the clinicians and the patients are an afterthought, right? Or are they starting from a clinical focus and working backwards and seeing, okay, this is the real big pool of technologies that's available. What parts of these pools can we pull in to solve that problem and make the life of everyone easy, right? So I think this is an important conceptual thing that we believe in very strongly at Citrus, is you use tech to solve a clinical problem, not the other way around. You don't build tech and then go, okay, what's your problem that you want to solve, right? Which is the way a lot of companies, unfortunately, do think in certain ways differently than we do. But we go backwards: problem, patient, and what are our solutions? What do we use in our toolkit to solve that problem? So that's, I think, what we want to share with the audience that you have and folks, that we're really focused on solving a real global crisis that is today. And it's only going to get bigger as the survivorship pool expands, as we get more and more sophisticated with cancer treatments. We're doing a fantastic job taking care of cancer. When I started doing this 10, 15 years ago, we were talking months, maybe a year to cancer patients, right? Now I have patients who've lived a decade, right? They're driving their Harley Davidsons around the country. We're ready to completely that was not even a discussion 10 years ago, right? So we're the next HIV.
Mm-hmm.
In the 80s, everyone died with HIV, or people had lots of problems. Then we got better with treating it. And now people live with side effects. That's the cancer world we are going to be in, and we are in right now. And that's my projection. This is why technologies like this are going to be so imperative, and and it's going to touch so many different individuals, so many different levels of their work and life.
Well, this has been so informative, inspiring. And as we wrap up, how do people find you? Tell us, how you'd like to be found as we're coming to an end.
Yeah, right now, our website, there's lots of information on our website. There's one of the things that you can do is directly call us. I mean, there's a phone number there, and there's our team members will immediately see how we can help you, even if you're not active in the state. We're happy to use our network to try and connect you with the right physician to get the help that you need. So, I mean, those are probably the best ways. But you can also email us info@citrusoncology.com. So if you want to talk partnerships, if you want to do a little bit of that, investment that to support us, that would be all welcome.
Yeah, we're looking forward to hearing from folks, whether it's patients, it's physicians, or providers. We're always recruiting. We're always looking to help patients out. And, investors who believe in what we do, who really see that this is a problem and are looking for a strong physician AI commercial-backed team, we are all ears to have to meet with them. And our website is citrusoncology.com, where they can go and find us, and there's information on it as well.
Well, awesome. This has been really great. So glad you came on, and wish you all the best of success.
Well, thank you so much for having us on your podcast, on your video, and your YouTube channel, Michael. Thank you so much.
Awesome.
Yeah, thanks for doing this, Michael.